Bert Eicholt, Health Officer of Mobile County, Alabama. Today is January the 20th, 2022. We're excited that we have tested over 18,000 people at the Festival Center since we moved to that location. Unfortunately, we've not been able to get more supplies for testing because of the national program that's allowing people to test at home. It's really going to be more convenient for everybody to test at home without having to come stand in lines and get out of the house when they're not feeling well. So we're in this transition phase. Unfortunately, COVID is still with us. We've had a slight decrease in the number of patients in the hospital currently. Our high number was 302, and today we're at 297. That's not statistically significant, but it is. We'll take any steps in the right direction we can. So we're optimistic that the community spread of COVID-19 right now hopefully has plateaued, and that we can see a decrease in community hospitalizations. But we're very excited that everyone can receive home testing supplies through the federal government, and we will provide that website information so you can order your test kits, not have to stand in line, especially during inclement weather. We're looking at other options as we move forward and we get resupplied, probably having some type of appointment scheduling at the Festival Center in order to test and vaccinate. But the most important thing we need to tell you is vaccination material is adequate supplied at the Festival Center, no appointment needed. So between now and Mardi Gras, please get vaccinated, and if you're eligible, get boosted. That is the most important thing you can do. We know that serious hospitalizations are prevented by being vaccinated, and it's one of the few tools we have in our toolbox to really help us get ready to have a wonderful Mardi Gras celebration in Mobile, Alabama. So we anticipate that things are going to continue to get better in the community transmission rate over the next couple of 3 weeks. And for those who are in the hospital right now suffering from COVID, know that our thoughts and prayers are with you for a good outcome. There will be further loss of life, but we hope we can minimize this with our community efforts. So thank you, everyone, and have a great weekend.
Hello, everyone. I'm Rundy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department. Thank you to Dr. Eicholt for sharing some remarks with us today. Today is Thursday, January 20th. I'm here to give you a brief update on the impact of COVID-19, talk a little bit about the news yesterday that our Festival Center location will no longer be able to provide community testing, but more on that in a minute. So yesterday, 868 cases of COVID-19 were reported to us. That brings our total to 99,856. So we won't be doing Facebook Live tomorrow, but keep an eye on the report. We almost definitely will exceed 100,000 cases of COVID-19 in Mobile County residents since our outbreak began in March of 2020. That's, 1/4 of our population, although we know that some people have gotten it more than once, but still a remarkable milestone, reaching 100,000 cases. We heard about one additional death with COVID yesterday, bringing that number to 1,428, and then 46 people were either hospitalized with COVID or in the hospital and diagnosed with COVID. And yesterday in the hospital, as Dr. Eicholt mentioned, we had a slight reduction in the number of people in the hospital down to 297. I think that, we all want to kind of look at that and hope that that's a plateau and that we're maybe going down on the other side, but we'll just have to give it another couple of days before we see whether or not that reduction is a trend. Couple of things of note, we're still seeing mostly female, so around 56% of people who are getting COVID in the last couple of weeks are female, or at least these are the people who are testing positive for COVID and getting reported to us. We know that in general, women tend to seek care more often than men. But maybe more importantly is to look at the age distribution of our cases. And around 18% of the cases reported to us were in people less than 18 years old. So we still can see more children getting COVID, being diagnosed with COVID, being hospitalized with COVID than we have seen before. So that is interesting, of course, to note, because our children under the age of 5 are not eligible for vaccine. So they are more susceptible, and our vaccination rates for 5 to 17-year-olds are lower than any other age group. So we really need to get vaccination up in those people that are under 18 years old to try to prevent or delay or reduce transmission in those age groups. And then if they do get COVID, then they should have less severe illness by having some of the immunity to help fight the infection that comes with vaccination. So let me talk just a little bit about our news release that we will no longer be able to offer walk-in or appointment. We're not going to be able to offer any testing at Festival Center. It seems like every couple of months things change on the COVID front, and just while we're kind of getting in a groove, something changes and we have to adjust and adapt to what's new or different. And things right now are just, we're repeating ourselves, where we have had in the past year and a half or so the availability of point of care rapid tests to us, either free from the federal government or purchased with our federal funds. And that's no longer the case. So we've had an open order for at least a month on, I think, a little over $300,000 worth of COVID tests that we have ordered some time ago, and just have received just a trickle of that. We've gotten 75 boxes. That would not even help us get through a Friday, Saturday to stay open. So it's been very difficult to make this decision, but we're no longer going to be able to test it at the Festival Center. The good news is, I think you've all seen, if you go to covidtests.gov, you can enter your address, and late January expect to receive 4 COVID tests for at-home testing. We're really excited that the federal government appears to be making good on their promise to make at-home testing available to every household. Testing in your house is a great advantage over coming to the Festival Center or any other place to get tested, because you don't have to get out in the community to potentially expose others if you have COVID. We want to make sure that we encourage all businesses, all schools, institutions of higher learning. You must accept the results of an at-home test. It's really important that you accept the results of these at-home tests. So I realize that there maybe is a tendency to say, I need documentation, I need a form, I need a letter, but these at-home tests do not have that option. So again, this is a transition, a new phase of our COVID pandemic, in that with this transition to at-home testing, patients will not have documentation from the health department or documentation from the urgent care or from their doctor. But it's still really important that you accept the results of these at-home tests. The other thing that's going to be different is that at the Festival Center, when we test people, when they test positive, we report that to the state health department. And there's currently no mechanism for people to report an at-home positive test to public health. So take your report and mark a line between the date of the 19th and tomorrow's report of the 20th, because since we are no longer testing, there's anywhere from 200 to 400 positive COVID people that will not be showing up on our report. So it's going to look like we immediately see a drop-off in cases reported to us. It's going to look like, hey, maybe our outbreak's over and we can all, celebrate Mardi Gras and other things without our mask, but that's not true. We still have a lot of transmission. Our case counts are going to go down because the health department is no longer testing. And just please continue to watch those numbers of hospitalizations. That will be our measure for how things are looking in the community for a little while, until we kind of see where our daily case rate kind of falls out. And again, we hope that things are plateauing now and are beginning to decline. That's what the models have shown. Our early data have shown that as well. But we will not peak probably in hospitalizations and deaths for another week to 3 weeks. And then nobody knows what the impact of Mardi Gras is going to have on our case count. So again, if you are choosing to celebrate Mardi Gras this year with balls and socials and parties and parade attendance, please get vaccinated, wear your mask, Stay with your family unit. Try to keep away. I know it's hard when you're all fighting for the same pair of beads to keep your distance, but just please be smart. If you are attending a ball, sit with tables with people that you know are vaccinated. Maybe reduce the length of time that you're at the ball. There are things that you can do and that the event planners can do to try to reduce transmission in those situations. So the only other thing I wanted to talk about is we found out from the state health department that the state of Alabama, and I think most states, will no longer be receiving allocations of Johnson & Johnson vaccine. It's being removed from our state immunization ordering system. So Johnson & Johnson vaccine is definitely being phased out, and we've heard that there is being some reduction in the allocation of Moderna vaccine that we may be getting. We have plenty of Pfizer. So come out to the Festival Center and get your vaccine, get that series started. Also, the state of Alabama this week received 550 courses of sotrovimab. This is the monoclonal antibody that is used to treat people who have Omicron infections early in infection, who are at risk of severe disease, to help keep them out of the hospital. That's still only 7% of the requests, so it's still an extremely limited supply. So please don't rely on a therapeutic to keep you out of the hospital. Please take a vaccine. And then the state of Alabama did not get an allocation of Paxlovid this week. That's the antiviral that you can get through a prescription. That one is on a 2-week rotation for allocation. So the state is saying they're hearing that the allocation for Paxlovid is likely not going up until late April. So again, please don't rely on these therapeutics to keep you out of the hospital after you get COVID. Please get a vaccine. I also want to address, we get a lot of questions, people wanting to know, do they have Omicron or Delta? You have COVID. So it's really important that a rapid test cannot tell you what variant you have. That can only be determined through genetic sequencing, which is a very complex process. It takes 4 or 5 days. There are some shorter processes, but again, this is not the information that is available to 99.9% of the people who have COVID. So right now, 99% of what we have in the county is Omicron. So if you have COVID, you have Omicron, but it's no different. It's like if you have influenza, it doesn't matter if you have H1N1 or H3N2 or A3 or B1, if you have influenza. So again, just follow the guidance for quarantine and isolation, and staying at home and all of those things. If you've tested positive for COVID-19, try not to worry too much. Like I said, almost everything we have right now is Omicron. And then I think that's all I wanted to say. Going back to us not being able to provide community testing for COVID, we're really very proud of our staff at Festival Center and throughout our agency who have volunteered to work at Festival Center, that we've been able to provide this community testing for such a long time at no cost. Just walk in, get a result, and walk out. We don't know what the next phase of testing looks like for us. We will let you know when we find out, when we can get a constant supply. We may be able to pick back up community testing, and when we know what that's going to look like, you'll be the first to know. But again, in this time where guidance is confusing, is it 5 days, is it 10 days, just remember the message: stay at home if you're sick. If you're sick, don't go to school, don't go to work. If you have COVID in your household, your whole household is going to get COVID. So if you don't feel well, stay at home, call your office or call your provider or call your school. Just stay at home if you're sick so that we can try to reduce transmission of COVID-19 and influenza and any of the other respiratory viruses that are circulating this time of year. So that's it for today. We'll have another update for you Monday at 2:30. We'll see you then.
Thank you, Dr. Murphy. So in closing, what she said is extremely important. If you're sick, please stay at home. Questions have come up about supplies. The national movement about getting COVID testing to people in home has limited the availability in the retail stores and at the health department and at other traditional providers right now. So this effort to shift from testing outside of the home to inside the home is a major consumer of product. And so that is one of the driving forces while we're not able to do testing at multiple different sites around the area. But we've given you the website. It's Mobile County Health Department cares.com. Can give you information about where you can get tested. There are over 18 sites in Mobile County listed right now to do testing if you need to be tested outside of your home. So thank you, everyone. And remember, if you're sick, please stay at home, especially when going to any type of congregate setting like balls and potential super spreader events. Be kind to your friends, neighbors, and just sit it out. Don't wear a mask and say, oh, I'm feeling bad, but I'm wearing a mask. Just please don't go to work, school, or to play if you're sick. Thank you very much. We appreciate everybody's effort to limit the spread of COVID-19 in our community. Thank you.